guys, welcome to the Hygienist. Today we're going to talk about periodontal probing and what that includes. So when you first get here in the office, we always take a periodontal evaluation of your gum health. Jenny and I also both do it at every visit just to evaluate and see where things are at. So this is kind of what it looks like. We take a little measurement, it's called a probe, and it's measured in millimeters. So this first silver portion is 1 to 3 millimeters, and the one once it hits the black, that is 4 to 6 millimeters. So we're placing it right between this little space. That's a normal and healthy space. It should be there. That's the space you want to clean when you're flossing or using a water pick or some interdental device. And what we're looking for is if there's any inflammation or any bone loss. So this right here is your bone level that attaches the ligaments from your root to the bone and keeps that really healthy and secure. So what happens, this one right here is about a 2 millimeter pocket. When you get some inflammation, the tissue actually puffs up and inflames, and so this would show a 4 millimeter pocket typically. And then this is just infection and bacteria that has caused that tissue to be inflamed and irritated. And then the longer that sits there and longer that inflammation and infection harbors in that area, it starts causing issues to your surrounding supporting system, the bone level. So this is how it happens. The bone starts pulling away, and that pocket level usually still remains the same height, but you've lost the supporting tissues and structures underneath. And so this will result in a deeper pocket. And this is starting to move in what is called periodontal disease. There's bacteria and sometimes debris that is on your root surface. And so this is what we're looking for. How many pocketing areas do you have? The next thing we do is recession, and Jenny will go over that.
So recession, basically what we're measuring with that in millimeters is how much of that bone structure have you lost. A lot of people refer to this as, oh, they're long in the tooth, or your gums have pulled away from your teeth, when really it's not that your gums have pulled away, it's just that it has nothing to support it underneath because you've had bone loss. And then once that bone is lost, the gum tissue is going to follow that, and then you're going to have more surface exposed to, visually see even on each of your teeth that have this. So we measure that in millimeters, and we measure this every time to make sure that you're not getting more, because a lot of times you have this because you have periodontal disease or you're clenching and grinding. There's a lot of different reasons for it. Even aggressive brushing can cause recession. So if you have more every 6 months you come in, or every 3 months that you come in, we measure that to make sure, okay, like how fast are you losing that bone and that supporting structure, so that we can do something about it, so it doesn't happen in the future.
So the next thing we measure is called Furcations. And so this is the crowns of your teeth. There's roots that go down into that bone structure. Your front teeth only have 1 root, but your molars have 2 roots. So we measure this. The bone is supposed to cover those root surfaces, and if you've lost bone over time, if we can start feeling between those root structures, that's called a furcation. So we measure them in different numbers. A 1 means that we can just barely feel between those roots. A 2 means we can feel up underneath the root. 3 means we can see all the way through, or we can feel all the way through, and 4 means that it's fully down and we can just visually see all between those 2 root structures. So we measured that as well.
And you're probably gonna lose a tooth if that's happening.
Yes, so true.
And then the last 2 things that we measure, so we're gonna put a little resistance on each of your teeth and put a little pressure, and if it moves to that pressure and resistance, we call that mobility. And it doesn't mean that you're gonna lose a tooth if it's mobile. It just tells us a story about what's going on underneath the surface with that tooth. And then we measure bleeding. So we measure 6 different sites around each tooth. So in between the teeth, tongue side and cheek side, and then on the surface of the tooth that you usually brush. And there's 6 possible sites of bleeding around each tooth. Same with pocketing as well. And we'll do a 1/4 of the mouth on one side, and we'll then, after we're done getting all the measurements with that, we'll tell the person who's recording we have bleeding on number 3, mesial, or number 4, distal, and we go through and we just measure all the bleeding sites. And usually, we'll talk about this in a future video too, but usually bleeding isn't because we're trying to hurt you or we did something to your gum tissue. It's
because of this infection that's
because
going
of
on.
because of the irritation and the buildup of bacteria and its infection. So if you kind of went around an infection on your hand, it would also bleed. It's the same type of story.
Exactly. So we're going to do a demonstration really quick of just how it's done in the mouth, and we'll be doing the demonstration on Jed. So we're going to walk around each tooth. And you can see how the little instrument goes just beneath the gum tissue. So it depends on the office, but most offices record all of the numbers, all of those things that we went over at least once a year. So just make sure your hygienist is doing that. And if you have any questions about what she's doing or he is doing, and if you don't hear the numbers and stuff, you can always ask, hey, look, what were my numbers today? What do they mean? We're doing this for a reason. It's not just to poke around and find a place to start or something. We are doing it for a specific reason. So
have a great day, and we'll see you next time.